Frankovich has been working in the social service field for over 30 years, and the last 5 years as a social worker in several dialysis clinics. She has loved working with people who have chronic or terminal illnesses, including end-stage renal disease, HIV/AIDS, diabetes, substance abuse addiction, as well as breast and cervical cancer. It brings her great joy when clients, patients, caregivers, coworkers, and friends are able to learn and implement strategies that empower them to live their best life. Carmi is accompanied by her good friends, Pamela Trice and Melody Ellsworth. Please welcome Carmi, Pamela, and Melody.
Good morning. Good morning. So this is going to be an experiential workshop, folks. And we're going to be doing some tapping together, which means you're going to want to be able to see what I'm doing because you're going to be copying what I'm doing. So those folks in the back, if you've got really great eyesight, you are welcome to stay there. But more than likely, you might want to move a little bit closer because we're doing monkey see, monkey do. Later, not right away, so don't get anxious yet. If you want to stay put, you can stay put. So my invitation to you is that we read out loud together the title of this presentation, but we're going to tweak it just a little bit. Instead of saying you can manage your symptoms of stress, anxiety, etc., I would like us to say, I can manage my symptoms of stress, anxiety, etc., etc. So can you see it up on the screen? All right, so on the count of 3, we're going to read this together, but you're going to say I. 1, 2, 3. I can manage my symptoms of stress, anxiety, frustration, depression, pain, fear, cravings, etc. with EFT tapping. Well done. See, you're really good at audience participation. All right. So my name is Carmi, and I am a dialysis social worker, and I've been working in social services for 30 years, and I started tapping a couple of years ago. I would really like to know who's in the room right now. So with a show of hands, please tell me if you are currently or if you in the past were on dialysis. Okay, great. So maybe about half of you. Raise your hand if you have kidney disease, but you've never done dialysis before. Okay, good, 1 or 2, all right. If you are a caregiver or a significant other of someone with kidney disease, please raise your hand. Thank you. And if you're a medical provider of some type, let me know that too. Okay, good, perfect, great. The reason I'm asking is because we're going to use some examples, and I want you to be able to relate to those examples. So that's why I want to know who's in the room. I also want to share with you what my intention is of this, of our time together. And I'm going to read it to you, even though it's up on the screen. It's for each one of you to recognize your ability to manage your symptoms and to experience relief from your symptoms because you tapped or utilized another healthy coping strategy. So, as a social worker, I talk with a lot of dialysis patients, and I'm always asking about their symptoms. You know, have you been experiencing any symptoms of depression, anxiety? I know if you're a dialysis patient, you're probably sick and tired of hearing us ask you that question. And then usually my next question is, how do you manage those symptoms? Maybe a quarter of the time, the response is, like they look at me with the blank look. Like, what do you mean, how do I manage those symptoms? You know, well, what do you do to make yourself feel better? What do you do to calm yourself down? And I get a variety of responses. What do you think, just shout it out, what do you think is one of the most common responses people have given me who are on dialysis about how they manage their symptoms? It might be pain, it might be depression. What do you think some people do? Did I hear pray? That was a great answer. Yeah, beautiful. Prayer is definitely a very common answer. Did I hear sleep? Yeah, that's probably the number one answer. Like, I go to sleep. I'm hoping that when I wake up, I'm going to feel better. It might be that they're fatigued, or they might be in pain, or they might be upset, or they might be feeling sad. And sometimes that works. I also hear music. A lot of people will abuse substances to be able to manage their pain, or not even abuse substances, just use substances. Obviously, pain medication is another way to manage pain. Some people will do deep breathing. Some people listen to music. Some people like to read the Bible, their daily meditations, or they call a friend. So tapping is just another strategy that you can use that is incredibly effective and immediate. Like, you can get results as you're tapping in the moment. And I will tell you stories in a little bit about how I've done that with dialysis patients and have had miraculous results. By the way, you can tap while you're reading the Bible. You can tap while you're talking on the phone to a friend. You can combine tapping with some of the techniques that you're already using. Do you have a question, sir? I saw you. If you could move your hands, you probably could. But you know what? I'm glad you brought that up. So the question was, can you tap while you're getting an MRI test? And that's really a great example, because a lot of us need to have medical procedures done that are anxiety provoking. A lot of us will postpone or not do medical procedures that we really should be doing because we get very worked up and nervous about it. You can tap on that. You can tap on just about anything. And in a little bit, we'll be talking about many different things that you can do. When I was listening to the speakers a few minutes ago, I was reminded that there are a lot of people that could be eligible for a transplant. Young people, middle-aged people, people that, could have a much extended life if they got a transplant or got multiple transplants, and they are scared. And I understand that. It's a risk. Every time you have surgery, it's a risk. Things can go wrong, right? Or there are patients that I've worked with who have had failed transplants. And so they're extra scared because they really have experienced what can go wrong. You can tap on that. Like, to be able to get yourself in a place where you're courageous enough to say, yes, I'm ready to move forward. Or perhaps you're a potential donor and you're very nervous about donating. You can tap on that. But anyway, I'd like to start with the story about how I got into tapping. So I was in a movie theater with two friends more than 10 years ago, so it's a very fuzzy memory. And it was a Michael Moore documentary about home foreclosures happening. And it just so happens that when I was a freshman in college, my parents lost their home. And I didn't really think that it was that traumatic at the time. But yet, when I started to get out of my seat at the theater, I was shaking, I was crying, I couldn't focus, I was triggered, very emotionally triggered. And I didn't know what was going on. I didn't understand that that's what was happening, that I was having an emotional crisis, and all that had come up from watching the movie. So I asked to go to the bathroom with my friends, and lucky for me, they were both therapists, a social worker and a therapist. And so they said, well, Carmi, we can teach you something to help you feel better, like right away. And I thought, well, that's unbelievable, but it can't hurt to try. So in the women's bathroom in the theater, they taught me something called the we exercise. Now, this is a form of tapping, and it's not the kind of tapping that we're going to do later, but I want you to know about it. It's super easy. It's called a butterfly hug, and you cross your hands across your chest like this, and you can either tap on your arms or you can tap on your chest, either one, and then you repeat something that goes like this. And I don't remember exactly what they had me say, but I probably said something like this. Even though I'm really upset right now, I deeply and completely love and accept myself. And I said that same sentence probably about 100 times. I just kept saying it over and over again as I was tapping. It's kind of like doing this, right? But with practice, you can get really good at it. And with less than 5 minutes. And by the way, it was getting very tedious. Like, oh my God, I've had enough of this. But they said, keep doing it. So I kept doing it. And then they had me report back to them how upset was I still. Now, before I started the tapping, they asked me to rate myself on a scale of 0 to 10, how intense was my upset. And I was, a 9 or a 10. I was incredibly upset. So then after about 5 minutes of this, they asked me to check in again. And I said, oh my gosh, I feel so much better. This is great. I'm like a 3 or a 4. And I was ready to go home. Like I was incredulous. And they said, no, we can get you down to a 0 or 1. And I'm like, are you kidding me? So I said, well, what do I do? And they said, just keep doing what you were doing. And I was like, oh God, that again, So then I just went back to the same sentence and the same butterfly hug for another 2 minutes. We stopped, I took a deep breath, I checked in. I started talking about the movie, I started talking about what had happened with my family, and I was symptom-free. Like I wasn't upset, I wasn't shaky, I didn't have that same emotional charge anymore. It was really amazing. So from that point forward, I always had that handout about what to do in my purse, so that if I ever got upset again or extremely triggered, I would always be able to pull that out and do it. Now that's not something you can do in the dialysis chair, right? Because you need to use your arms hooked up to the machine. But there's some other exercises I'm going to teach you that you can do with just one hand, and you can do it with your free hand during dialysis or at home or in the car or in the theater bathroom or in your own bathroom, wherever you want to do it. So that's my story. So I have a colleague whose name is Jan Hamning, and she is a tapping practitioner and a massage therapist. And she does tapping with a lot of folks for a lot of different reasons, but one of her areas of expertise is weight loss. And that's something that a lot of people struggle with, and a lot of people on dialysis struggle with. I also know that weight is oftentimes what's preventing some people from being able to get a transplant, or from some people being able to get a knee surgery, or they have diabetes issues, or whatever because of the weight. So I asked Jan if I could show you guys her website and also read from her website, which in a moment I will pull that up for you. Never Too Late to Lose the Weight is the name of her website. She also has a Facebook page. And I'm going to read to you her description of tapping. So EFT, otherwise known as tapping, stands for Emotional Freedom Technique. And it's acupressure technique based on the same energy meridians used in acupuncture. But instead of stimulating the pathways with needles, EFT uses tapping with your fingertips, You do this to yourself. So fingertips on the meridian endpoints while focusing on a negative emotion at hand. It could be fear, worry, bad memory, or anything that's bothering you at the moment. So when I was in the theater, it was a bad memory that came up. Through tapping, we're able to calm the nervous system, rewire the brain to respond in healthier ways, and restore the body's balance of energy. So while maintaining your mental focus on a particular issue, you use your fingertips to tap on specific meridian points of the body. Now, we're not going to get into where, what's energy and the meridian points and all that, because that is a very long explanation. And I'm going to encourage you, when you go home, to check out the websites in your handouts, because it will give you a very thorough explanation of some of these terms that I'm going to be using today. And it's also going to illustrate a lot of the research and the science behind EFT tapping. So tapping on these meridian endpoints while verbally or mentally addressing the root causes of distress sends a calming signal from the body to the brain, allowing you to feel relaxed and in control. And that's what happened to me. When I tapped in the theater bathroom, I was calming down my brain. There's an amazing mind-body connection, and when you can calm down the brain, your body will calm down as well. I also want you to know that EFT tapping is extremely popular. Millions of people around the world are using EFT tapping. And very, very famous people use EFT tapping. I have a video that if we have time, I'll show it to you later, of a lot of very informed, holistic, motivational speakers use tapping. You're gonna recognize some of the names: Dr. Oz, Wayne Dyer, Jack Canfield, the author of the Chicken Soup for the Soul books, lots and lots of people. If you go to some of these websites, you're gonna see some people that you recognize doing it. People that were in The Secret, if you read The Secret or saw the documentary The Secret, have utilized tapping. There's also something called the Tapping World Summit, and they do it every February. It's 10 days of free tapping videos and recordings that you can log on to and tap along with them and practice your tapping. So just as an example of how widespread tapping is, in the 2018 Tapping Summit, there was over 500,000 viewers during those 10 days. And that's just in English. I mean, there's many, many, many countries where they speak other languages where they're doing tapping in their own language. Okay, now we get to the good part. Can you hear me okay? Oh, this is much better. I hate being behind a podium. So if I had the time, when I'm in the dialysis clinic, all I would do is tap with my patients, because the opportunities to tap are everywhere. But unfortunately, duty calls, and we have lots of assessments to do and lots of paperwork to do. So I really only get to do it under extreme circumstances. And the extreme circumstances are usually when someone's in a chair and they are cringing in pain. And then that's when people are desperate to try anything. And if I was to show you what tapping looked like, you might be, oh, that looks really crazy. But when you're in pain, you will try anything. So the first story is about a gentleman a couple of years ago, and I walked by him and saw that he was in horrendous pain, and I asked if he had taken his pain medication, and he had taken it, an hour earlier, and it really wasn't helping. And I said, well, I got this cool thing that I can show you that we can do that might help. Are you willing to try it? And he said yes. And so we did it. I very quickly explained to him what it was. He copied what I was doing. And we did about 3 rounds, and we stopped, and I said, okay, how you feeling? And he said, oh my God, the pain is gone. And I said, you mean it's gotten better? You still have pain, but it's gotten better. He goes, no, my pain is completely gone. And I said, oh my God. And he said, oh my God. And we just got really so excited. And he said, and it was a valid question, how do I know that the pain medication didn't just kick in? And I said, well, that would be awfully ironic that the exact 5 minutes that we're tapping is when the pain medication kicked in. And typically when you take pain medication, does it totally clear the pain, or does it just take the edge off the pain? And he said, yeah, you're right. Usually the pain medication just takes the edge off. And he said, this is not like anything I've ever experienced before. So that was the first time that I used it on a dialysis patient. And from that point forward, I didn't care what people thought. I thought, if they're willing to try it, I'm going to do it with them. So about a year ago, again, there was a woman, she's probably in her mid-70s, and in tremendous amount of pain. And I did the same thing with her, although she was having a hard time, with her coordination. So she wasn't quite hitting the spots. I wasn't sure if she was hitting the spots strong enough. And so I said, Mary, is it okay if I tap on you? Is that okay? And she said yes. So she took her glasses off, and I just started tapping on her. Again, less than 5 minutes. And I could actually physically see her body relax as I was tapping on her. And then at the end of it, I said, well, how do you feel? And it's almost like she sounded like she was intoxicated. She could barely talk, and then she fell asleep. And I thought, well, that's a very good sign that she just fell asleep. And I just kind of sat back in my chair, astounded, because I never thought of myself as a social worker having the ability to physically take away somebody's physical pain. I am accustomed to being able to help people with their emotional pain. And I always thought, the medical personnel were the ones that could do the physical pain, but no. And it wasn't just that I did it, you can do it for yourself. And that's the beauty of this, is you don't need to be an expert, you just need to practice a little bit and get comfortable with it and do it. So there's a bunch of websites on the handout. One of them is called the Tapping Solution. And we're going to go to the website right now because they have a tapping sequence that we are going to use when we tap together. Now, you don't have to tap, but I'm going to strongly recommend that you do it. And if you wear glasses, keep them on so that you can see me demonstrate it first. But then when we tap together, you might need to take them off because you're going to be tapping next to your eye and you're going to be tapping under your eye. Now, you can keep the glasses on and do it, but it's just a little bit awkward. So keep that in mind, okay? How y'all doing out there? You're all awake, okay. By the way, don't be surprised if you start yawning while you tap. That's a very common symptom that happens when people tap. They start to yawn. I'm not going to take it personally if you do that. Okay, you have a handout that talks about the tapping sequence for anxiety. You can either follow along on the website. It might be easier to look at it in front of you. Actually, I need to have that too. Let me show you the tapping points, okay? So the karate chop is this part of your hand, and most people tap with their dominant hand. So I'm right-handed, I typically tap with my right hand. However, if you are a dialysis patient, I'm going to encourage you to practice today with whichever hand is not hooked up to the dialysis machine, okay? And you start, and Pam's going to also, Dr. Trice and Melody are going to kind of keep an eye on you so that if you're missing the point, they might approach you and say, oh, it's a little bit over here, it's a little under there, okay? So don't be surprised if you get a little coaching, because there's sometimes a little uncertainty about whether you're hitting the spot right or not. So when you think about karate chop, where you hit the board, that's your karate chop point, okay? So that's where we're going to start. And then after that, we go to the very top of the head, and you're going to tap on the top of your head, tap at the tip of your head. And then you go to the eyebrow, the very beginning of the eyebrow, where the eyebrow starts. It doesn't matter if you're on the right side or the left side. You can actually do both if you want. You might want to use one finger or two. And then the other spot is the side of your eye. Don't poke yourself in the eye. I had a couple of patients almost do that. So right about here. And then under your eye, there's a little bony area under your eye. You're going to tap under there. And then above your lip, so right here. And then under your lip, which is going to be here. And there's a crease there. You want to hit the crease. And then this is the part I'm always like, oh, am I in the right spot or not? You want to feel for your collarbone. And where your collarbone kind of meets, there's like a nodule. You want to go 1 inch down and then maybe another inch over. What I like to do is I use my whole hand, because I think to myself, if I use my whole hand, there's a better chance I'm going to hit the right spot. So I'm usually doing this. Some people will do this, okay? And then the last spot is under your arm. Look like a monkey. And for people that wear a bra, it's right where your bra strap is, a couple of inches under the armpit, right in here, okay? So what I just illustrated was, that's one round of tapping. So we're gonna do a couple of rounds, but before you tap, when you're at home practicing this on your own, you need to think about what's bothering me. Is it pain? Am I upset about something? Am I pissed about what my family member just said to me? Am I in dialysis and it's the last 45 minutes and I'm anxious to get going home and I'm having a hard time and I'm starting to think about cutting my treatment short? You know, is it I don't want to go to dialysis? Is it I don't want to do my physical therapy? You know, what are you resisting? What is it that you're dealing with? And you want to think about that. I want you to focus on whatever that is, okay? And then you're going to rate on a scale of 0 to 10 how intense that is. You know, like you're in the dialysis chair and you seriously are thinking about, I'm going to cut short my treatment and have them take me off early. That would be a 9 or a 10. That's pretty extreme, okay? Or I think I'm not going to get in the Pace Paratransit bus when it shows up to take me to dialysis because I really don't want to go. That's a 9 or a 10. You know what a 9 or 10 feels like for pain, okay? Then you're going to think about your setup statement. So the setup statement, we only use it in the beginning and only when we're doing the karate chop part. And it always starts with these couple of words. Even though I am, or even though I feel. So it could be, even though I really want to live longer and get a transplant, I'm super scared and I deeply and completely accept myself. So we end the setup statement with an affirmation. There's a whole variety of things you can say as your affirmation. Some people say, I deeply and completely love and accept myself. Some people say, I'm working on accepting myself. Some people say, and I'm okay. Some people say, well, my dog loves me. Like you can, you know, it's just gotta be some positive affirmation piece. So I'm going to assume that most of you in this room, if you scanned your body right now, have some type of discomfort in your body. It's either physical pain or there's some tension somewhere in your pain. So I'm going to propose that we use that as our theme for tapping together. So I'm going to ask all of you right now to do a body scan and look for where your discomfort is. Now, if you don't have any pain or discomfort, then you can pick something different, like I'm really upset about something, or I'm very worked up about something, and focus on that. Do whatever you want. Give yourself a rating, 0 to 10. Okay? And I'm gonna have you follow along with me. I'm gonna say the words, and then you're gonna repeat it. Then I'm gonna say the words, and you're gonna repeat it. If it doesn't resonate for you, say your own words. Does that make sense? Okay. And you're tapping nonstop as we're doing this. So watch my hand and follow along with me as I tap, okay? So first it's the setup statement, and then after we do that, we're gonna do very short phrases, like 1 or 2 words on the different tapping spots that I already showed you. So here we go. Get your whatever hand you're gonna use to tap with, get your karate chop. So even though I have this physical discomfort, I deeply and completely accept myself. Excellent. Keep tapping. Even though I'm tired of this discomfort that I have, sick and tired of it, I deeply and completely accept myself. We're going to do it one more time. 3 times the charm. Even though I'm so tired of this pain. Way to say it like you mean it. Don't say that. I deeply and completely accept myself. Excellent. Okay, now we're going to go to the top of the head. And again, we're just going to focus on what's bothering us. So this pain or discomfort. Good. Yeah, say it out loud. Beautiful. And now the eyebrow, where the eyebrow starts. Tap on that, right? You can do both or you can do one. Good. This discomfort in my body. Side of the eye. Tired of the pain. Under the eye. That pain, that pain. Above your lip. The tension in my body. Under your lip. This problem that's dogging me. Your chest area. This pain and discomfort. Under your arm. This pain in my body. That's one round. We're going to do another round. Top of the head. You guys are doing great. This pain in my body. Focus on your pain. Beginning of the eyebrow. This tension in my body. Side of the eye. This pain and discomfort. Under your eye. Tired of it. Above the lip. I'm really tired of it. Under your lip. By the way, you can swear while you're tapping. I'm freaking tired of it. Sick and tired, yeah. The chest area. This pain and discomfort. Mm-hmm. Under the arm. Tired of the pain. Great. Okay, now take a deep breath. Check in with your body or whatever it was that you were focusing on before we started and give yourself a rating, scale of 0 to 10. How intense is it now? Would anybody like to share what they're feeling right now? Yes, sir. What did you start at? You started at 10 and now you're at a 2? Very nice. Well, that was worth your 3 minutes. Yeah, I'm sorry, ma'am. Yeah, that's the common answer I get is calm and relaxed. And not everybody most people here didn't start with a level 10. The more symptomatic you are, the more you're going to feel the difference. I think I saw another hand in the back. Okay. Yes, sir.
I'm still poor.
You're still poor, yes. You went from an 8 to a 2? That's awesome. That's great. The one woman that I tapped on that was in all that pain, the one that fell asleep, when I asked her when she woke up how she was doing, she said, I'm tingling all over. And she said, I feel so great. I said, any pain? She said, no, I'm just tingling. And then her next question was, how long is this going to last? She was already thinking about the pain coming back, And I said, okay, thank you. And I said to her, I don't know how long that's going to last, but the beauty of it is that you can tap anytime it comes back. Now, the key, you guys, is to practice tapping when you're not triggered, when you're not in pain, when you can focus. Because I'm telling you, when you're in pain, or when you're really upset, or you're angry, or you're whatever, you're going to have a hard time remembering the tapping points. Literally, you do a couple of videos online, and you practice at home, pretty soon, you don't even have to think about it. It's in your muscle memory, right? It's just automatic. Like I said, you could be, in your dialysis chair doing this. You could be in the car doing this. Now, something else I do with a couple of dialysis patients is if they're a little bit out of it and they can't tap and they're very, very in a lot of pain, I will ask if I can hold their hand. And I'll stroke their hand very gently, and I'll use a soothing voice, trying to calm them down. And then I'll work my way over to their karate chop point, and I'll just start rubbing on that spot that we were tapping on. Because you have the option of rubbing. You don't have to tap. If you don't feel confident in tapping, you can rub on those endpoints that we were talking about. And you can also tap with a friend. So there's times when I'm really upset and I think to myself, I should be tapping right now. And then I resist doing it. And that's what we do, right? Like we know there's things that we should be doing for ourselves and we resist it. Tapping can actually help you break through that resistance. So what I tell myself is, okay, that's just too much work right now to say all those things and to, tap on all those points, and I'm not in the mood. So I'll just tap on my karate chop point. I'm just gonna tap on the karate chop point. That's all I'm gonna do. And I'll be darned, after about, 20 taps on the karate chop point, I start to relax a little bit, and then I'm like, oh, well, I'll just start doing a couple of, points, but I'm not gonna say anything. And then I'm like, oh, well, I feel better. Then all of a sudden I start saying out loud what's bothering me. And by the way, you can just ramble on. You could just be doing this. I really don't want to go to dialysis today. Dialysis sucks. I hate how I feel afterwards. I really should get a transplant, but I'm really too scared to get a transplant. I wish I could get over this fear of getting the transplant. I know I'm supposed to be doing my physical therapy. I don't feel like doing my physical therapy. They told me I should go for a walk, but I don't want to go for a walk. And just those thoughts that are in your head, say them out loud as you tap. It's really not too difficult, but you got to practice it. And you're the only person that's going to be motivated or not motivated to practice. I got a 10-minute notice a few minutes ago, so there's all kinds of information at those websites that give you hints about how hard to tap, where exactly to tap. In your handout, there's actually a picture of a person with the tapping points on them. There's also other tapping points you can tap on that you'll learn about in those other websites. You can also do affirmations, and you can tap on affirmations. I'm really going to encourage you to continue your education on your own. I am a licensed clinical social worker. My contact information is in the handout. If you have questions or something's coming up for you while you're tapping, you are welcome to email me or call me. I can do a free 15-minute consultation if you want to tap along with me. You can hire someone. There's tapping practitioners online. So if you want a coach, you can actually do that from the comfort of your own home. Or you can even do it during dialysis. You could have a coach coaching you on your laptop during dialysis. So there's lots that you can do with it, and I think I need to start winding down, huh? Okay, I have some books on display here about tapping. One of them is for weight loss. One of them is for pain relief. One of them is just a general tapping book. I also purchased, how I told you about the World Tapping Summit? You can also purchase those presentations on CD. So I did do that a couple of years ago. So that's there as well. I encourage you, again, there's all kinds of free information on these websites. You can even go to YouTube and put in the search engine tapping for anger, tapping for frustration, whatever it is you're dealing with it. And they're gonna, a bunch of tapping YouTube videos are gonna show up. Now, some of them are better than others. I prefer the tap along videos that are on the websites that I gave you. And again, you wanna pick one where they do what I did with you. They say something, you say it. They're tapping, you follow along with them. But again, you can make up your own words. There's nothing magic. There's no magic wording. You just want to focus on whatever it is that's bothering you. My time is up. So if you have any other questions, please feel free to grab me afterwards. And the books are up here. My business cards are up here. If you didn't get the handouts, we have the handouts up here. And again, I just really encourage you to do your homework and tap. Thank you very much for your time and attention.